Welcome to the module, Talking to Your Patients About Antibiotics for Bacterial and Viral Infections, a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. This learning module was developed for licensed staff who talk with patients and are patient representatives who work in multiple healthcare settings and who care for a variety of patients. The purpose of this course is to further your learning and build on your current knowledge about antibiotic stewardship. What you know and how you use that information improves the quality and safety of the patients you care for. This learning module, Talking to Your Patients About Antibiotics for Bacterial and Viral Infections, provides a general overview and demonstration about how to have conversations with patients and our patient representatives about the safe use of antibiotics. After listening to this short educational module, participants will be able to describe what to say to patients and or patient representatives about when it is appropriate to take antibiotics, antibiotic resistance, and the dangers of misuse. Describe what to say to patient and or patient representatives about preventing infections, and demonstrate best practices when discussing benefits and risks of antibiotic use with the patient and or a patient representative. At times, antibiotics are prescribed inappropriately due to pressure from patients and or patient representatives. This document was created to guide your conversations about when it is safe to use antibiotics. It includes talking points to explain the similarities and differences of bacteria and viruses, antibiotic risks and benefits, how to prevent illness and spread of infection, and ways to heal your body other than antibiotics during an illness. We will now demonstrate how a conversation about whether or not to prescribe antibiotics might go.
Hi, Christy. I am Lisa Gall, a nurse practitioner for urgent care telehealth. I understand you've not been feeling well. Can you tell me more about your symptoms and when they started?
Hi, Lisa. Nice to meet you. Well, yeah, I would say I woke up 3 days ago with kind of a mild headache and a stuffy nose at night. And then my nose is kind of runny during the day. My mouth is also really dry, particularly in the morning. And I've been coughing up this kind of thick green phlegm in the morning, and it gets kind of lighter color during the day. But yesterday my voice got really hoarse and my throat hurts when I cough. I'm not quite as hoarse anymore, but it seems like my nose is getting stuffier and my headache, it just isn't going away.
I'm sorry to hear that. On a scale of 1 to 10, and 10 being the worst headache of your life, can you tell me how severe your headaches are?
Okay, 10 is the worst. I would say 4.
Okay. Does anything make it better or worse?
Well, the headache, I've been taking ibuprofen, and that certainly helps. For the sore throat and the cough, it's better when I drink like hot tea, like with honey. And I've been doing like some salt water gargles because my throat's been irritating me. And for the cough, I do use like cough drops occasionally, and they help a little bit.
Awesome. So you're doing, everything that you can to help your symptoms. It sounds like you have a 3-day history of gradually worsening nasal congestion and runny nose. Nothing seems to help that. You have a mild to moderate headache. It's relieved with ibuprofen. Your sore throat and hoarseness and dry mouth are worse in the morning, but that's somewhat relieved by drinking warm tea with honey and saltwater gargles, and a persistent cough, which you're using cough drops to provide temporary relief. Is that correct?
Yeah, I would say that pretty much sums it up.
So do you have any other symptoms such as shaking chills, fever, chest pain, shortness of breath?
No, I don't have any of that. I'm just like really tired, and I don't want this to get any worse. My daughter's wedding is coming up in a few weeks, I just don't want to be sick. I get sinus infections a couple times a year, usually in the spring and the fall, and it usually I take antibiotics to clear it up. By the way, I did take a COVID test yesterday that was negative.
Okay, great. I'm glad you checked for COVID. Just a couple other clarifying questions to make sure you don't have some other things going on. Is there any ear pain or stiffness in your neck, light sensitivity? Also, so any of that going on?
No, I would say no.
Okay. Do you smoke or have you been exposed to dust, fumes, or smoke?
Never smoked.
Okay. Do you have any allergies, seasonal allergies?
Mm-mm.
Okay. So good. I'm glad you're not having any of those severe, other symptoms. And it appears that your symptoms are still rather in the early stages, if you call that. And we know that most colds and sinus symptoms are caused by viral infections, not bacterial infections. So at this time, we would like you, instead of using antibiotics, which are for bacterial infections, is to continue to use your home treatments and over-the-counter remedies to help you manage your symptoms.
Yeah, I hear what you're saying, but I really want an antibiotic. So if you could write me a script, I mean, it's always worked well in the past to get rid of these symptoms. So I'm miserable. I'm worried about the wedding. So yeah, I would just like an antibiotic.
Yes, I understand that has been your treatment in the past. However, we're finding that those cold and sinus symptoms that are not treated with antibiotics will improve with the same amount of time and actually with better results, because you see, infections caused by viruses and harmful bacteria can cause similar symptoms. They're both spread through exposure by coughing, sneezing, contact with other people, surfaces, food, and water. And they both can cause mild, moderate, and severe disease, and sometimes even death, like the pandemic did with COVID. In fact, however, antibiotics will not kill viruses and can actually add harm by causing more side effects. They can even cause severe illness or death from complications. You see that antibiotics cannot tell the difference between harmful and helpful bacteria. They actually kill or weaken the bacteria that keep us healthy. Every year, thousands of people get sick with C. diff, a severe life-threatening illness that interrupts the normal bacteria in our guts. This in itself can lead to death in very young, very old, or people with other health conditions.
You're telling me antibiotics are going to kill me?
That's not usually the case, and it's infrequently the case, but people can get very sick from C. diff, and in rare cases, it can lead to death.
Okay, but what about this really bad sore throat I've got? Maybe I've got strep or something, so maybe I ought to get tested, huh?
Well, based on your symptoms and what you're telling me, this doesn't appear to be strep. If you develop swollen glands, a rash, vomiting, or fever, then we would perform a strep test. If it appears that your throat is irritated from the phlegm, which is also causing discomfort when you cough. So here's some tips maybe that can help you control those symptoms. First, continue using over-the-counter medications like Tylenol, ibuprofen. And it's really important to use Mucinex or Mucinex DM, which is for coughing in addition to thinning the secretions. So Mucinex thins the secretions so you can cough or blow out the drainage. Also, drinking lots of fluids, at least 8 cups a day, can help doing that. And the hot teas that you're taking will help with that as well. For relieving your sore throat, gargle several times a day using a teaspoon of salt in a cup of warm water. You can also continue using that honey with lemon tea or lozenges for the sore throat. And then finally, use a neti pot or some saline nasal sprays in your nostrils twice a day to clear out some of those secretions, make them thin, get them able to be expelled.
Okay, but so what if I still have some of this, when the wedding comes around, am I contagious? Do I have to worry about that?
So I think it's really important to repeat your COVID test in a couple days or before the wedding to make sure you're not infecting others with potentially dangerous viruses. No one wants to come to a wedding and pick up COVID and have severe consequences, and you don't want to spread it at a wedding. So while you're sick, it's important to avoid spreading illness to others, as many respiratory viruses are spread through coughing, sneezing. And COVID is actually spread by droplets hanging in the air. So if you are still symptomatic, do wear a mask. If you have no COVID, if your COVID test is negative, you can still wear a mask. Cover your mouth when you cough. Also, it's important to wash your hands frequently, especially before and after you cough or touch your face. Third, keep your distance from others at least 6 feet apart and avoid prolonged exposures to others you are in contact with. So it's important to avoid contact with immune suppressed people, and that's the very old, very young, or people on certain medications or conditions like cancer. And I know that it is a lot to ask is if your daughter's getting married and if you have COVID, obviously, my suggestion is not to go if you're in active COVID. But however, if you have respiratory symptoms like a virus, you can use these methods to avoid spreading the viruses to them. So I'm going to send you a pamphlet to review everything we discussed, including when antibiotics should or shouldn't be used. And I'll send that by email.
All right. Well, what if I get worse or my symptoms just aren't going away? What do I do?
Yes, good question. Please do call the clinic if your symptoms are not getting better or they last longer than 2 weeks, or if you develop worsening facial or ear pain, any of those shaking, chills, fevers over 100 degrees for longer than 48 hours.
All right, I'll give it some time. I hope it'll get better. Time for the wedding.
I certainly do too. Just to be clear on what you understand, when will you decide if it's necessary to get in touch with us again?
Okay, well, let me see. I am going to give you a call if I'm not better in a few weeks, or if I develop, I think you said facial or ear pain.
Yes.
And then if I get a fever over 100 for more than 2 days, of course, if I get like really bad shaking chills, I'll give the clinic a call. I think you also said I should do another COVID test in a couple days and prior to the wedding. Of course, if that's positive, I'm going to call you back.
Right, because we'd have some very specific instructions for you on, what your treatment for COVID is.
Okay.
And you got it. Hopefully, however, this should blow over in the next few days to a week. Usually sinus symptoms peak in about 3 to 5 days and then gradually get better after that. It can last up to 10 to 14 days on a normal course. I hope you enjoy the wedding though.
Okay, well, I thank you very much. And I assume that these recommendations you'll put them in the portal for me so I don't forget.
Yes, we will have them ready for you in your portal. Please check within the next half an hour.
Okay, thank you so much.
Have a great day.
Okay, you too.
Note that a link to the Talking to Your Patients About Antibiotics for Bacterial and Viral Infections resource is included on this slide and on the Frontline Forces webpage and in the YouTube description below. You may also choose to refer to other references included in this slide.